Hi everyone, I'm Dr. Jonathan Lee, Associate Professor of Medicine at Harvard Medical School and the Brigham Women's Hospital, and the Director of the Harvard Brigham Virology Specialty Laboratory in Boston. Today we'll be reviewing updates to anti-SARS-CoV-2 monoclonal antibodies and their role in pre-exposure prophylaxis. So here's the status of COVID-19, especially with the Omicron variant. There's been now more than 77 million cases. And since Omicron variant has been detected, cases grew exponentially. And at one point, there was nearly 1 million cases a day. Omicron itself is actually a very different virus than what has come before it, with additional 30 amino acid substitutions, especially in the spike region. With, in addition, there are small deletions and insertions as well. And preliminary evidence does indicate that Omicron is less severe than Delta variant, although once you take into account prior infection and vaccination status, that effect does narrow and probably is somewhere in the order of maybe 25% decreased severity, which can still mean that it is a very severe infection. It is definitely more contagious, as evidenced by the rapid increase in cases. In December 2021, bamlanivimab and etesevimab received approval for children aged less than 12, and then subsequently, tixagevimab received EUA approval for pre-exposure prophylaxis in immunosuppressed individuals. Also, in the same month, which was a very busy month, casirivimab and imdevimab and BAM-EDI were found to lack efficacy against Omicron variant, and their use was largely restricted to areas where the Omicron variant was not prevalent. And then eventually, in January, it was decided to actually hold the distribution of bamlanivimab, etesevimab, and casirivimab and imdevimab because of the prevalence of the Omicron variant.
Also in December 2021, 2 oral treatments received an EUA for patients with mild to moderate COVID-19 who are at high risk of progression to severe COVID-19, nirmatrelvir plus ritonavir and molnupiravir. In January 2022, the EUA for remdesivir was expanded to include treatment of mild to moderate COVID-19 in patients at high risk of progression to severe COVID-19. In February 2022, bebtelovimab, another monoclonal antibody, received an EUA for treatment of mild to moderate COVID-19. This treatment is restricted to high-risk patients aged 12 and older.
What about the monoclonal antibodies that are still active? Well, tixagevimab, silgevimab is one such combination. These 2 monoclonal antibodies bind to distinct non-overlapping epitopes on the spike receptor binding domain, or RBD. Because they bind to different aspects, they do have a higher barrier to viral escape. They also have some modifications that potentially decrease some antibody-associated side effects, and also modifications to extend the half-life. And in the phase 3 PROVENT trial for pre-exposure prophylaxis, the trial found a 77% reduction in symptomatic COVID-19. There were 2 COVID-19 related deaths in the placebo arm versus none in the tixagevimab, silgevimab arm, and then the adverse events were similar between groups. And you can see here the Kaplan-Meier curves really showing the how those who received AZD7442, which is tixagevimab, silgevimab, were largely protected from infection. Tixagevimab, silgevimab received EUA approval in December 2021 for patients aged 12 years or older weighing at least 40 kilograms. They're not currently approved for those who are infected with COVID-19 or had recent exposure. And these individuals must have moderate to severe immune compromise and due to either a medical condition or immunosuppressive medications, and who may not mount an adequate immune response to vaccinations. Or they could be for individuals whose vaccination is not recommended due to a history of severe adverse reactions. Individuals are administered this monoclonal antibody at least 2 weeks after COVID-19 vaccination to allow the vaccine to have the maximal effect. And they receive 2 separate intramuscular injections for one of each of these monoclonal antibodies. And based on in vitro studies, tixagevimab, silgevimab is expected to maintain efficacy against the Omicron variant. Thank you very much for joining me today. For more information on anti-SARS-CoV-2 monoclonal antibodies for pre-exposure prophylaxis, please visit the series landing page at exchangecme.com. For the latest updates on COVID-19, subscribe to Exchange CME's YouTube channel and check back regularly. Thank you.